Hello everyone, here is Dr. Molinari, and in this video I'm going to talk about acne. So, what is acne? Acne is a chronic inflammatory condition of the pilosebaceous unit. We can see here the pilosebaceous unit with the glands, and this part is what is commonly called common. This one is a open comedon, of course affect both teens and adults, and is not caused by a poor hygiene. So what we can see, usually this one is pus, and when we have pus, that means we have a bacterial and a overgrown bacterial that lead to the formation of pus. So how acne forms? Of course, increased sebum production from the glands. We can see here that this one is a gland of the pilosebaceous, and the glands is increase the sebum production. We have a bacterial overgrowth, that is these blue dots in these images, and the overgrowth of the bacteria lead to the formation of pus. The pus is formed from the bacteria and some immunitary cells such as neutrophil. Of course, excess of keratin. So we have a cap of keratin that doesn't permit the explosion of the pus. Of course, inflammation. We can see in these images that the cup is very red. Commonly, the inflammation, when there is an inflammation, we can see red and swollen part of the body. Type of lesion. So open comedons, this one, and closed comedons, this one is I think is more common. This one is considered the fourth step of this disease, and this one is the very common lesion. We can see it in the patients. There are also other type of lesion, papules, pustules, and nodules. Usually, this kind of lesion is more common in advanced phase of this disease. So the difference between papule and nodule is just the size. So the nodule is bigger. If you check in the book, you can see the difference on 0.5 centimeter difference. So nodule is bigger than 0.5 centimeter, and papule is less. Pustules is pretty close to a closed comedon, but it's a little different. So changing the size, it's bigger than the closed comedon, and there is pus as well. So why we have acne? So we have an overgrown bacteria, and there are some factors that can lead worse than the acne, such as hormonal fluctuation. So it's very common to see worse acne in people that has a hormonal fluctuation. Usually, when we use some medication, we can see here. So some medications such as testosterone that lead to a hormonal dysfunction and lead to develop the acne. Of course, stress. Cosmetics. So when we choose a cosmetic, we will should choose a cosmetic that is not occlusive. Pick or squeezing. So pick or squeezing is very not dangerous, but it can lead to a scar of the skin. And if you developed a scar in your skin, can be very difficult the treatment for that scar. So common myths, chocolate causes acne, that's not true, or any kind of sugar or sweets, as I told you, it's lead from bacterial. You just need to wash more. No, it's not related to a poor hygiene. It will go away on its own. No, you need therapy. Pumping people's helps, as I told you before, it can lead to a scarring lesion, and it becomes very difficult to treat. Common mistakes: over exfoliating. So usually when you have acne, you have to use very delicately exfoliating, using too many products, switching routines too often, and of course squeezing the lesion. what really helps. So simple routine, gentle cleanser, no comedogenic moisturizer, daily sunscreen, and in the worst case, evaluation for a specific treatment from a dermatologist. So when to see a professional? So we can go to a doctor when you have moderate or too severe acne. So what is moderate or too severe acne? As I told you before, when you have some kind of lesions such as pustules and nodules, and it depends also in which part of your body the acne is, because we usually think the acne in the face, but it can be also in your back, and it's very important the size of the disease, how many of your skin is occupied from this. Also, early scarring. So when you developed early scarring in the beginning, if the nodules are painful, or you have any painful related to the acne, and emotional impact. So we need to understand this one is not just a skin disease, but it can affect also the psychological life. So if this disease, you know, it's changed life for you, that's need to be treated. Key takeaways, of course. So acne is a disease. It's not a personal fault. It doesn't depend on what you eat. Consistencies matter. There are effective treatment. In the next video, I will speak about the treatment the dermatologist can prescribe to you. Thank you for watching. See you soon in the next video.